Call the hearing back to order. Thank you all for your patience. We will now return to questions of the first panel, and it's a great privilege to recognize the ranking member, the judge and congressman from the great state of Texas, Mr. Hall.
Thank you, Mr. Chairman. Mr. O'Connor, the chairman of the big committee, asked you some questions and inquired about why it was relegated to alcohol. There's a reason for that, is there not? What your scope was?
Yes, sir. The scope of my investigation was to look at the specific case that the two instances reported represented, and that was space flight safety, Soyuz shuttle, and to try to deal with that and try to understand whether or not we had adequate controls in place. If something like this happened, what was the nature of it, so we could deal with how to remedy it. We did not expand that to look at alcohol use among astronauts in a broader sense. That might take a different kind of a study, a little longer if we were to do something like that. We didn't really need to do that. What we did was we kind of triaged this whole thing. When we first saw the words flight safety, that, of course, raises a flag in my shop. And the very first thing we did was we talked to the crew that was getting ready to launch the shuttle. And we sat down with them and we talked to them about communications, about descent. What happens if the flight surgeon and the managers disagree? Do they know how to use the system properly? And that was the first step. The second step was to do this investigation focused on flight safety for Soyuz and shuttle. The third step then is the follow-up with the anonymous survey that we'll be doing that has a much broader scope. It looks at the whole aspect of communications and relationships among flight crew and flight surgeons in the broader sense.
And with not having all the purported facts at your disposal, you were somewhat at a disadvantage, were you not?
Well, when I was at a sort of a disadvantage in that there's always a chance that someone may not feel comfortable talking to their safety guy.
Well, with no complaints against Colonel Bachmann, you weren't given the benefit of the many interviews that he made on many thrusts of this. Tell us about that, and I'm going to ask Colonel Bachmann to give us that information too.
Well, after we got Colonel Bachmann's report, he added some more information after that on two occasions for me, but he was hesitant and really could not give me more than that because of the promises that they had made to their own witnesses.
You know, up here and in this committee and in this Congress, you soon learn who you can depend on and whose word is good, and if their word's not good, nothing else is very good about them usually. And I think you took that attitude toward Colonel Bachmann, that he was keeping his word.
Yes, sir. That's why I didn't challenge it and treated it as I would any other anonymous report we get through our anonymous systems.
Colonel Bachmann, you couldn't give him all the facts because you had agreed to those from whom you extracted a lot of those facts that you wouldn't reveal their identity nor their employer. Is that correct?
Yes, sir, that's correct. We acknowledge that they're all NASA personnel and astronauts and flight surgeons, but that's really as far as we were willing to go.
And you did that only because you didn't believe you could extract some of the answers from them that you extracted had you not agreed to give them the full cover. That's a correct statement, isn't it?
Yes, sir, really twofold. We wanted them to speak freely, and we were focused on systems issues rather than any one individual.
They spoke freely knowing you weren't going to reveal their names and their employment to be scrutinized further by others who had the duty to scrutinize them further. Isn't that correct?
Absolutely. Yes, sir.
All right. Mr. O'Connor then came down to you, and you have scrutinized and observed many mishaps and many close calls and Have there ever been any that involved alcohol or drug use or abuse by astronauts since you've been doing that? Yes or no?
No, sir.
And have you, I think you said 680 anonymous safety concerns that were anonymous to Colonel Bachmann, reported to and investigated by the NASA Safety Reporting System since its inception in 1987? None of them involved astronaut alcohol or drug use or abuse. Is that a correct statement?
That's correct.
And of the 863 safety hotline reports recorded since its inception in 1991 to the present, none involved alcohol or drug use or abuse by an astronaut. Correct?
That's correct.
And although Johnson Space Center doesn't reveal the identities of personnel involved in disciplinary actions, the most recent report to OSHA covered the years 2002 through 2006, includes a total of 7 such actions related to alcohol or drugs at the center. Informal input from flight crew operations was that none of these involved astronauts.
That's correct.
And for the last, of more than 90 individuals who answered your call for information, not one offered any evidence of alcohol use or abuse in the immediate pre-flight time frame. Isn't that correct?
Yes, sir, with the one exception that since then there have been 40 more, so I'd raise that number to 130.
All right. And I would ask you this. I know in the aftermath of the Challenger and the Columbia accidents, NASA has tried very hard to ensure that there are open, independent communication paths to raise safety concerns. That's something I've been very involved in, and wanting a module that was an escape hatch, and insisted on it and had money in the budget for it a couple of 3 times. One time, I think, maybe one of the older astronauts that went up there after he was my age used a little some of that to go up and back, and I didn't like that, but I did like the fact that you were letting older astronauts go now and then. But for those safety concerns, would you please discuss policies and or procedures that are now in place to ensure employees are encouraged to report any safety of flight issues, and would you please discuss how, if at all, you're changing or revising these policies?
Yes, sir. As you mentioned, we put the NASA Safety Reporting System into place after the Challenger accident. The purpose of it was to address those occasional cases where an employee does not feel comfortable using normal open means of communication. Maybe they had a disagreement with their supervisor and didn't feel they could go any higher. We put this system in place as a last resort for safety communications. Since its inception, as you heard, we've had 680 people who have used it for various reasons, including lack of communications or disregard for my concern, the kind of things that we talked about today. Those things have been part of that reporting system over the years.
And as my last question, I know my time's up. You, in your duty to report to the NASA administrator, you were, as we would say in Texas and out on the ranch, you were kind of bridle halted in that you didn't have the full facts to report to him because they weren't available to you. Is that correct?
That's one way of putting it, yes, sir.
I'll yield back my time. Thank you.
Gentleman's time is expired, and I will now claim 5 minutes for myself. I want to start with Colonel Bachmann. First of all, I sort of feel a little bit like what Ralph Hall's comments were at the very beginning a while ago. I think I'm in so much awe and hold the astronaut corps in such respect that I wonder why it's unfortunate we had to have this kind of hearing. But I have a great deal of respect, and I know that the astronauts are committed to their families and to NASA and to our country and to our communities, and I have a tremendous amount of respect for everything that they do. Colonel Bachmann, I know that there are a lot of astronauts who feel that the reports of alcohol use in your report have tarnished the reputation of the astronaut corps unfairly. As we've heard today, your report included 2 instances of alcohol use that NASA says it was unable to verify. With all the confusion we've had since the report came out, I'd like to sort of ask you to help us clear the air and ask just a few questions on that. Does the inclusion of the alcohol incidents in your report indicate your committee indicate that your committee thought that there was widespread abuse of alcohol in the astronaut corps?
Sir, as we said in the report and as we said in the press conference when the report was released, the committee does not have sufficient information to describe the extent of alcohol use, alcohol problems in NASA, in the astronaut corps. What we had were specific instances described to us, and we felt not as an underlying alcohol problem, but as an underlying risk communication human factors problem. And that the astronauts and flight surgeons were so concerned about how this information was handled that they brought those to us as kind of the prime examples, although they had many others. Those were the ones that were concerning most to them.
How many people on your committee actually heard reports from individual astronauts regarding alcohol use?
The interviews took place over the space of several days. The bulk of them took place with multiple members of the committee in the room. The concerns brought forward by the flight surgeons, as best we can recall, we had at least 3 committee members in the room at the time that that particular story was told to us, the instance was described.
How many people are on the committee?
There are 8 altogether.
8, and 3 heard the...
Sorry, I'd say at least 3. Again, people were coming and going, but I know that at least 3, if not more. The astronaut described alcohol incident was described to one member of the committee who brought that information back to the rest of us, and we discussed it.
What were you trying to say when you included the 2 incidents that were volunteered to your committee by interviewees? Was there, what did you want to try to accomplish with that?
Sir, again, we were highlighting the concerns that the NASA individuals felt, and they used these particular instances and others, but these particular instances were of greatest concern to them, that they used as examples of how significant safety issues did not receive traction when they were sent forward, that their professional opinions about the fitness for duty or the ability of the astronauts to do the task did not receive what they consider to be sufficient attention.
Do you think that there is any real evidence to indicate that there is a significant problem of alcohol abuse in the astronaut corps?
Sir, as we said in the report and during the press conference, we don't have a sufficient number of interviews to tell you how pervasive alcohol use problems might be. The description that we provided of the rules or lack of rules that governed use of alcohol in the crew quarters or the lack of a 12-hour rule explicitly defined for space flight all have been validated by NASA, and in fact those were some of the first actions they took, was to institute explicit rules on the use of alcohol in those settings. So we believe that makes the rest of the story more credible as well. The rest of the situation that they described has actually been validated by NASA.
Before he left, Chairman Gordon had asked some questions, and I'm going to take the remaining time to give you an opportunity to ask those. He had said, what was your review panel's basis for making the statement of peers and staff fear ostracism if they identify their own or others' problems? And how confident are you that it doesn't represent just the view of 1 or 2 malcontents?
Sir, the first part of that is, how do we know that these don't represent just an isolated individual or a collection of individuals? And how do we reconcile that with the signed letter by, looks like the bulk of the flight surgeons at NASA? I'd have to defer the answer back to the flight surgeons. In the group of people that told us that story, I am confident that some of the members that signed that letter saying that they essentially everything's fine were present in the room when the story was told. So I can't answer how they could tell one thing to us and sign a different letter out to NASA. And as far as the statement about ostracism and issues with their peers, again, those were the words that the astronauts and the flight surgeons told to us. Those were not our interpretation. It's more of a summary, but those are the words that were used when the NASA people described the issue to the committee.
I know my time is up, but I'm going to take a little bit of the time that Bart Garden gave up a while ago to get his questions in and answers. And he had gotten down to the point where he made a statement of your restatement of a report. NASA must ensure that people can identify such safety and performance concerns within NASA without fear of reprisal or career injury, and asked, were you told of any instances where your interviewees had been subjected to reprisals or had witnessed other individuals being subjected to them?
Several vignettes were described where, and in this particular case, flight surgeons described instances where they brought concerns forward and they were subjected to what they called public humiliation. We didn't pursue it further than that, again, because the point of the issue was their reluctance to bring things forward because of how similar issues had been handled in the past.
What does NASA need to do to fix the problem your review panel uncovered?
I think the most important thing, again, is for the NASA leadership at the highest levels to clearly state that they are concerned, and I think they've done that, and make every effort to get appropriate information that really will give them a sense for the scope of the issue. Face-to-face interviews are not the best way to get sensitive information when people feel their jobs might be at risk or that they might have other career consequences. That's why, again, we emphasize the need for a valid and anonymous survey that is not seen as a mere exercise, but actually seen as vital to the success of NASA's future missions, where people will feel that they can speak freely. If it is narrowly scoped or not clear to people that they can respond without somebody being able to figure out who said it, I'm afraid that you could certainly get a useless piece of information back. And that's where I think the whole crux of the follow-up to this hearing and this committee's work is to get good information from all NASA personnel affected by these issues.
From the folks that I have spoken with, the leadership at NASA, areas where I have talked, I believe that their commitment is to accomplish that. I think I hold them in very, very high regard, and I know that their concern about safety and success both at NASA are of utmost importance, and I know that we'll be going forward with it. I have gone way over my time, and I will now recognize Mr. Nagelbauer from Texas. I'm sorry, Mr. Bonin. Joe, excuse me.
No problem, Mr. Chairman. Randy is a handsome fellow.
Well, neither of you have much hair.
I noticed that when I looked in the mirror this morning. Colonel, let me follow up to the answer you just gave the chairman because I think it is timely. Could you expand on any recommendations that you would like to see that would help guide NASA in the future toward a development of more adequate follow-up surveys or questionnaires?
Yes, sir. In fact, in the Air Force, we have what's called a unit climate assessment that we routinely do upon taking command of a new organization. And since I've had the privilege of being a commander for a number of organizations, certainly nothing as large as NASA, but the survey is constructed with questions that you can answer on a 1 to 5 scale about how important or less important or critical or going well. You can give them the scope. You can put a number. And that actually generates some interesting data. But the more interesting data as a commander have been the free text blocks where people can type as much as they see fit to tell you what they're thinking. And honestly, if you see a comment made once and you never see it pop up again on anybody else's survey, that's interesting. And maybe you'll want to go ask some more questions. But if you see similar issues come up in different voices, all pointing in the same direction, whether the number scale is consistent with that or not, you know you've got a problem, and you have to go figure out what's going on. And the Air Force, at least, is, I think, from where I sit, pretty good at keeping the information on who said it pretty secret. They have rules about demographics. If it asks you if you're a woman and you only have two, it'll hide that information from you, so you can't go figure out who the woman over 40 was in your unit that said that. And again, I would say that the questions need to be broadly, or at least start broad. And then they can get as specific as NASA sees fit, so they can answer specific questions. Are you aware of alcohol use, in the immediate pre-flight period, so that they were intoxicated when they went to a vehicle? That's one question. But a much broader question is, are you aware of human factors issues that you feel didn't get appropriate attention? And then give them a text block where they can type in as many examples as they can think of. So I think there is a science to conducting surveys, and I'm certainly not an expert in that, but there are people who are, and I think that's who NASA is or should be looking at to help them build a survey that will get them the information they need.
As a follow-up, and this is really for the whole panel, how should NASA deal with an astronaut's natural reluctance to raise health or behavioral issues that they fear or believe may jeopardize their selection for future missions or assignments, and especially the two who have gone up? Based on your experience, are your colleagues, are members of the astronaut corps confident that they can raise health issues or emotional or family problems without fear of jeopardizing their NASA careers? But it's really open to the whole panel. Dr. Ochoa?
I'll take that question. And first, I would like to say that I'm glad to hear that Colonel Bachmann and I are on the same page regarding the survey. We are planning a survey exactly as he has described. It will have a combination of qualitative and quantitative questions so that people do answer on a 5-point scale, as well as have the opportunity to write in comments in a number of cases. I have not actually noticed astronauts being shy about bringing up issues of many different types of natures, but we want to make sure that they do feel comfortable. We believe the survey will give us some very good information about that. We have a number of other programs in place where we emphasize to astronauts continuously about looking out for themselves and their crewmates. One of the main programs that we have is known as either crew resource management or cockpit resource management, and you've probably heard about it from the aviation industry. But a lot of it is to prevent crew error, obviously, in critical situations. And what they're really looking at is not skills and knowledge, but how do you understand when you or one of your crewmates may be tired, may be distracted, may not be feeling well, may be more prone to make errors? So anytime we do a training session where we have a group of astronauts as a crew training together, the very first thing that we debrief is the crew resource management. And so we're always talking about looking out for each other and making sure that we're working as an effective team. We also have a program in place called the Expedition Interpersonal Training Program, which was started several years ago because we wanted to prepare people for the long-duration missions that they were going to have on the space station and also beyond. And part of that program, we have workshops where we learn from previous expeditions, not only space expeditions, but Antarctic expeditions, things like that, how people have dealt with interpersonal issues. We have cross-cultural training since we fly with astronauts from different countries. And we send people on outdoor leadership classes with trained supervisors where they talk about human factors issues. They talk about leadership styles. They talk about how do you keep a team going, even if there's issues with one or more members of the team. The astronauts are given verbal feedback from the experienced leaders of those courses, and then each member of the team that has gone out and done this course essentially rates every other team member, sort of anonymously. So at the end of that course, each astronaut that has participated has feedback from every other person that they've been with to understand how they did themselves and how they are perceived by others.
Thank you very much. We may have a follow-up question in writing to get a little bit more specific answer to the question, but thank you very much for that. Mr. Chairman, thank you.
Thank you, Mr. Bonner. I know we have a lot of additional questions for the panel, but we're going to move to our second witness, Dr. Griffin. If I might, I'd like to pose one question for the record to Colonel Bachmann, and then also let it be known per the committee rules that any member can submit additional questions record. Before we broke for the votes, Colonel, I was talking about your sobering words, the effect in the committee report that issues of cultural and structural note are so ingrained and longstanding that it would take senior leadership action to remediate them. I would ask you to provide the subcommittee with some specifics on the type of senior leadership action that you think are needed. Another way to put it would be, what are the most important 3 things that NASA senior leadership needs to do to resolve the problems identified in your report, so that we don't have to have another hearing like this a few years from now. So I'm not asking you to answer that today, but if you'd submit your thoughts for the record, I know the subcommittee would appreciate it.
Yes, sir, will do.
Again, I want to thank the panel. This has been very enlightening. I think I would speak for everybody on the subcommittee when it comes to clearly every one of yours commitment to NASA and to having the finest astronaut corps anywhere in the world. We look forward to working with you further. Thank you again. And at this point, I dismiss this panel, and we'll ask Dr. Griffin to join us at the table. Dr. Griffin, thank you for joining us. I don't think the good doctor needs an introduction of any length. We all know his talents and his commitment to NASA and his many, many successes. Thank you for joining us, and the floor is yours for as long as you need it, Dr.
Mr. Chairman, Ranking Member Hall from the full committee, members, thank you very much for Mr. Feeney, members of the committee. Thank you for inviting me here today. I do have to admit, I wish it were under better circumstances. We all recognize that the behavior that led to the arrest of former astronaut Lisa Nowak, the murder of NASA engineer David Beverly in his office at the Johnson Space Center, and this recent report by a panel of outside experts containing allegations of improper use of alcohol by astronauts has shaken public confidence in NASA. NASA is an institution comprised of our nation's best and brightest, an institution responsible for carrying out one of the noblest missions of our government and our nation. The personal conduct of NASA's workforce, including our astronauts, must be of the highest standards, beyond reproach. And day in and day out, we do indeed demonstrate just such professional excellence and dedication to our mission. But in the face of the allegations and adversity which we've encountered recently, we must ask and answer hard questions, and we've done that. The case of former astronaut Nowak is a matter for the courts to decide and is not an appropriate subject of comment for me here today. But as a direct result of that unfortunate incident, we did last February begin an in-depth review of how we might better provide for the behavioral health of our astronaut corps. Shannon Dale and I asked Dr. Richard Williams, NASA's Chief Health and Medical Officer, to organize a committee with membership external to NASA and having expertise in aerospace medicine and psychiatry to review the medical and behavioral health services provided to our astronauts. We sought external advisors because we were concerned that we might have missed something with which others in the field with experience outside of NASA were more familiar. This review committee, chaired by Dr. Bachmann, Commander and Dean of the U.S. Air Force School of Aerospace Medicine, provided me with their final report this past July. Now, the report contained numerous findings and recommendations, many of which will be useful to us as we go forward. Without question, the portion of the report which has received the most attention was the citation by the panel of certain allegations of improper use of alcohol by astronauts preparing to fly, and further, that concerns expressed by flight surgeons on this point had been ignored by NASA management. Now, given the seriousness of these allegations, the only responsible action we could take was to investigate them. Accordingly, Shanna and I asked NASA's Chief of Safety and Mission Assurance, Bryan O'Connor, from whom you've just heard, to conduct a careful examination of claims that astronauts had been impaired by alcohol in the immediate pre-flight period, as well as claims that management had not been responsive to concerns by flight surgeons and others about astronauts' fitness to fly. As you've heard from Bryan, his extensive review found no evidence to support the claims that any astronauts were ever impaired by alcohol at launch time. Further, NASA's flight surgeons have I would say the bulk of NASA's flight surgeons have voluntarily put their names on a communication to Bryan saying that they had no evidence of impairment by astronauts on flight day, nor any instance of their concerns to management being disregarded. This has been the subject of earlier discussion. We take, and I take, these allegations very seriously, just as we would any issue that could impact the safety of our missions. But at the same time, I've also said that the stories cited in the report seem improbable to those of us familiar with the astronauts' rigorous and very public activities in the hours leading up to a spaceflight. I personally began working with our astronauts more than 25 years ago, and I know many former and current members of the Corps as valued colleagues and personal friends. The cited allegation of alcohol impairment prior to flight is simply not in accord with the behavior that I've personally seen from our flight crews. Now, this allegation aside, the committee put substantial time, thought, and effort into their report. They really did. And we're grateful for their service in helping us to make NASA a better agency, and we're taking action to address the other concerns and recommendations from their report, which we believe will improve our astronaut health care procedures. I've enumerated the actions we are taking in response to this report in my written testimony to this committee. One of those is that NASA's Astronaut Office is developing a formal code of conduct that will outline the professional standards expected of members of the astronaut corps. Now, Chairman Udall and other members of this subcommittee, you will recall that many concerns about NASA's culture were expressed in the aftermath of both Space Shuttle Challenger and Columbia accidents. And there were indeed unfortunate similarities in how those accidents occurred. A common theme was the reluctance of senior managers to listen to and evaluate carefully concerns expressed by subordinates. Nothing is more important to me than this matter. I have established as a non-negotiable criterion for management at NASA, starting with those who report directly to me, that we must not fail to listen respectfully to our people. We must not fail to investigate and adjudicate the concerns which they express. We must not fail to act if necessary. In today's NASA, with the approach we have taken to implementing the recommendation of the Columbia Accident Investigation Board to provide independent technical authority at NASA, every employee has at least 2 independent pathways which they may use to bring forth concerns to upper management. I've made the point on numerous occasions that there will be no retribution for employees at any level who bring forward a concern, that there will be praise, and that there will be respectful treatment of the concern, and it will be adjudicated. I believe that this is a matter of trust and that this trust has been kept. Now, I must point out that respectful treatment of an opinion does not necessarily imply a decision in one's favor. Any argument or dispute which reaches NASA managers has at least 2 people, and almost always more, who disagree, and it is not possible to decide in favor of all parties. But it is possible to provide all parties with a careful and respectful hearing, and that is what I seek for our agency. Again, this is a matter of trust, and that is the culture change which I believe was needed and is occurring at NASA. Now, one cannot prove a negative. I cannot prove that no one at NASA is afraid to speak up. But I hope that that's not the case, and I will use this forum to ask once again, anyone who is watching this testimony, if you have a concern, please come forward directly to me if necessary, and if necessary, I will protect your identity. But I must have facts, if they are out there, in order to make decisions. Mr. Chairman, in this and many other ways, we hope to restore any loss of public confidence in NASA that may have resulted from these unfortunate incidents. Thank you.
Thank you, Dr. Griffin, Administrator Griffin. I know the subcommittee would now like to turn to some questions, and then the chair recognizes himself for 5 minutes. You talked about the recommendations in the report and your intention to implement them. Do you have a timeline off which you're operating when it comes to the implementation?
Well, I don't know by what date Dr. Williams plans to bring recommendations or an assessment back to Shanna and I. He probably does. My own view is that this is both important and urgent, but is more important to get right than to get done quickly. It is important that we treat this advice as respectfully as we treat all advice from our advisory panels, whether of permanent standing, such as the NASA Advisory Council or the Aerospace Safety Advisory Panel, or ad hoc, as was this panel. It is important that we treat their advice respectfully and that we evaluate it carefully, while nonetheless recognizing that at the end of the day, you and other oversight committees and committee chairmen hold NASA responsible for our actions. So we will evaluate the recommendations carefully. We are already of a mind, as I've said several times, to accept most of them. We will report to you any disagreement between the recommendations we choose to accept and those that we possibly think are not a good idea, and we'll discuss. We will report back to you on the implementation, how the implementation is going. And we will do it as quickly as we can do it and yet do it well.
Thank you for that straightforward answer, Dr. Griffin. I'd like to turn to the committee's, the external committee's recommendation in particular about carrying out a thorough anonymous survey that's carefully worded to obtain a valid, actionable information. And Dr. Griffin, from the testimony of Dr. Ochoa and others, it sounds as if NASA is prepared to conduct such a survey.
I cannot wait to do that.
And it's not clear to me, however, that NASA has a lot of experience in crafting that kind of a carefully worded, thorough survey that Colonel Bachmann recommended. Could I ask you if NASA is planning to have a proposed survey, this proposed survey reviewed by any external organization that has expertise in this area? And if that isn't your current plan, would you be willing to do so in the interest of ensuring that NASA gets the best survey possible?
I believe that Ellen expressed her agreement with Colonel Bachmann on all the points regarding the survey, and yeah, of course, we will craft what we think is the right survey, and we will have it reviewed by external experts in this matter to make sure that it is a well-done survey. In the course of pursuing my studies for an MBA, I had one course in market analysis, and I feel that if that course served no other purpose, it served to sensitize me to the way in which results purportedly obtained from a survey can depend on how the survey is worded and what the sampling environment is and who the target sample audience is. So I join Colonel Bachmann in declining any expertise in this matter, except to know that it is fraught with concern, and we will be very careful.
If I can editorialize briefly, knowing what I know of your private sector experience, I think you learned a lot more from that class than you suggest, given the successes you had.
Well, I didn't drive anybody into bankruptcy, if that's what you mean, so I'll take that as an upcheck.
Be careful, we may get you involved in the subprime lending solutions. A final question, Dr. Griffin. The JSC internal review noted that employees said if they're concerned about coworkers' behaviors, they'd raise concerns with the coworker management or flight medicine official. However, the external reviews you've heard report notes that the flight surgeons were demoralized because their concerns were not valued. Do you have any specific plans at this point to do anything about this apparent disconnect?
Well, I do. Much of it will have to be, will rely, again, I will use this forum to emphasize, if anyone has a concern, please use NASA Safety Reporting System to write it down and send it in. Your anonymity will be protected. If anyone at NASA is concerned about an immediate supervisor or a supervisor's supervisor, then, and that concern exists, bring it to me. Many do so. My inbox stays full. And I don't think there's a person out there who can report back that a concern which was expressed to me was not dealt with. Meaning, let me avoid the double negatives. I do deal with any concerns brought to me. I try to follow up. Less formally than those mechanisms, I talk regularly, periodically I visit with our flight docs as I am at flight readiness reviews and shuttle launch operations. I hope that it is clear to our flight surgeons, as it is clear to our engineers and our scientists, that not only do I want them to feel free to speak up, but they have an obligation to do so. In fact, at this point, I have to insert a concern. If we have people at NASA in today's environment who believe that they can't speak up for fear of retribution or ostracism, then I would urge them to go that extra mile and speak up, because that is their obligation. I need people working for NASA in this most demanding of environments, where we launch people or hundreds of millions or billions of dollars of hardware into space. To work in this most demanding environment requires much, and it requires that people have the courage to bring forth their concerns to a management chain which has stated openly over and over again that you will receive a hearing. I think our actions as a management team over the last 2.5 years have supported that. When I came on board, one of the very first things I had to do was to delay a shuttle launch that I desperately wanted to go. I had to delay it by several months because some engineers expressed to me their concerns that we had not done an adequate job of calculating all the debris trajectories, particularly ice debris, and particularly off of the LOX feed line bellows. So we did that. Then I had to address a few months later a concern by some of our Earth scientists, or some community Earth scientists, who felt that their research was being modified for public release, or that their concerns were not being appropriately heard. And we got all over that. And I made it clear in an extraordinarily clear written policy that the purpose of scientific and engineering investigation is to get at truth, and we do that through argument, through public discourse. There have been other opportunities to address criticisms of lack of openness at NASA and concerns over retribution, and in every single case we have taken the side of open discourse, and I will do it again here. So if there is anyone at NASA who has a concern, bring it forward. I need to hear it.
Thank you, Dr. Griffin. I want to recognize the ranking member, but before I do, I did want to, in the context of a serious and important and substantive hearing today, comment positively on the process by which the situation with Endeavor was considered. I think it demonstrated the cultural changes that outside and internal groups have recommended, and perhaps it's the model also for what we're trying to do here, which is to drive some changes in how we manage the astronaut corps and how behavioral and medical problems and all, but also potential upsides are reinforced and supported.
I think that process was NASA in action at its finest, and we did not launch with unanimity. Some engineers disagreed that the tile should fly, should re-enter, and that a repair needed. Others felt that it was fine. I personally heard all of the arguments on that matter, and we decided to fly, and that was the right decision, as it turned out. But the people who felt we should not re-enter that way were certainly not ignored or disregarded. During that same launch operation, I had lunch, well, I had many occasions to visit with flight docs, and I asked one of them privately, is there any possible way that you would feel a concern or an issue in bringing forth a concern? And the gentleman laughed at me and said, you're worried about a medical doctor bringing forth a concern? You know, this particular gentleman said, I have no respect for a medical doctor who has a concern and fears that his job is in jeopardy. Now, that was an anonymous conversation, and it will stay anonymous, but there's a point there.
Thank you. The chair now recognizes the ranking member, Mr. Feeney, for 5 minutes, or whatever time you...
Well, I'll try to keep it to 5. Thank you, Mr. Chairman. And again, I think this is an important hearing to clear the air, number one, and get this behind us, and number two, to improve any procedures that we can undertake that will help us improve. And I think that you've taken it in that spirit. And I want to tell you, you said more than once in your testimony that in the light of NOAC discussion, or the NOAC incident and the discussion about astronauts flying while they may have been intoxicated pre-flight, that there has been a loss of confidence in NASA. I really don't sense that. And I can tell you I haven't lost an ounce of confidence in NASA or in you. I am confident that in complex organizations that have the most complex of obligations and challenges, that things are going to go wrong. And sometimes they will be technical, and sometimes they will be human factors, and sometimes they will be bad luck. But this is modern day America, 24/7 news, and bad luck doesn't happen. Everything is somebody's fault. And I think you're learning that, Dr. Griffin. So like it or not, we are where we are. And I want to tell you, I sympathize with how frustrating it is, because there were some specific anecdotes in the Bachmann report. By the way, I don't dismiss anything about the Bachmann report. I don't think you have either.
Or did
These
I?
are very credible people that I think undertook a very important mission. But the specific incidents that have made such news can't be documented or corroborated. And the more general allegations that it's a cultural problem that needs attention from the top senior leadership, fighting cultural problems is a little bit like shadow boxing, because I think that your administration has undertaken to change the culture about reporting. And like I said, I witnessed the one incident live as we watched a shuttle go off. But I guess in light of the fact that my goal is to go forward, I think that's what the chairman of the committee wants to do. It's what most of us want to do, and improve constantly the operations of NASA. And I'm glad that we have had focus on this physiological, psychological, and physical well-being. The recommendations, for the most part, are not at issue that the Bachmann committee has made. But what is at issue is whether or not there is a cultural problem here. I mean, the last thing that the colonel told us is that we need to fix the communications problem. And yet you and Dr. Ochoa and Mr. Williams and Mr. O'Connor have said there are multiple avenues, independently, anonymously, that have been set in place in NASA in the last few years, and that includes flight surgeons or astronauts that have concerns about human safety. So I guess the question I have is, Bachmann report suggests there is a cultural problem which is decades old, involving communications about human well-being. I'm hearing from the NASA team unanimously that you do not believe that to be the case, even though you have adopted the recommendations, or most of them, about how to fix that communications problem. Can you address that? Because why are we fixing something that's not broken, I guess, would be a simple way to ask that question.
Well, and as the administrator, actually, that is the most important question for me. There is, I mean, I think I have made it clear, and if anyone doubts my word, then I guess they do, but there's nothing more important to me in an agency like NASA than having an open, free, non-political discourse on difficult topics, because what we do is not easy. We have to work very, very hard to get it right, and we don't always do that. But when we get it right, when we decide what we think the right course of action is, we should pursue that no matter what. And then we only arrive at that through extensive and open discourse by all parties, and I believe in that. Now, if we have had in the past cultural problems and we are trying to fix those, I can't guarantee that they're completely fixed. I can only, again, entreat people to trust this management team. I believe it when Colonel Bachmann says that the fact that people are willing to speak anonymously and not willing to speak face-to-face on the record is itself a problem. Yes, it is. At the same time, I have no mechanism to deal with the fact of somebody saying, I have a concern, but if I am afraid if I speak my concern that I will be ostracized, so I will keep it to myself. I mean, you can see the logical conundrum there. So all we can do is again, create a record, create a long-standing record of responding fairly, respectfully, positively to any concern brought to us, and hope that that record of behavior will bring forth the further behavior of the type that we seek. That is what I am desperately trying to do.
Thank you. I'll yield back, Mr. Chairman. Oh, well, just you know, just briefly. It's very hard sitting here to tell. Either the Bachmann report was correct, that multiple witnesses consistently said there's a communications intimidation factor, or what the NASA team, including you and the folks that testified before you, have said, that you've done everything reasonably possible to fix it and you're encouraging people. The recommendations that the committee made, whether the communications system now works as well as it can or not, will they do any harm if you adopt there? Is it going to add new bureaucracy, costs, or do you think those recommendations will enhance human safety regardless of whether there is a communications problem?
Well, our medical policy board just looked at those issues and expressed an early view that our response to those recommendations, being generally accepting of them, was a good thing. Okay, and I support that view. I certainly don't think that they will do any harm. Yes, if we add additional process and procedure, there's an opportunity cost of that. That means that some other activity of lesser importance will not get done. We will try to be judicious about that, and we will try not to impose a bureaucracy in our healthcare system. But because communication is the sine qua non of all organizational management, we must invest in improving communication if, in fact, there are issues. I don't believe we have the issues that have been raised, and I've said that, but I'm prepared to have my belief overturned by facts. I absolutely am. I can assert to you beyond question that my face-to-face communications, my telephone communications, and my email communications are filled up with people who do not find me too intimidating to talk to. But of course, I can't identify those out there who find me too intimidating to talk to and thus are reluctant to express their opinion. So we will continue to work on encouraging open communication. I believe in I love this agency, I love this enterprise, I love these people that we work with, and we want to make it as the best that it can possibly be. I've never worked with finer people than we have engaged in the process of launching folks into space or the folks who go into space. I've never worked with finer people. They're not perfect. And oh, by the way, I'm not perfect either. And we're trying as hard as we can to get this right. It's most difficult. It is most difficult in the softer areas. If you want to ask me about the thermal margin on a tile, I can deal with that, probably until you fall asleep. If you want to ask me how do we know we have the best possible communication processes, I don't know. It's very hard, but we're trying.
Well, a great philosopher, Woody Allen, once said that 90% of life was just showing up. And what you're telling people, if they've got problems with NASA issues, technical or human factors, they got to show up.
Please show up. The decisions are made by the people who show up.
I'll yield back, Mr. Chairman.
Mr. Hall is recognized.
Chairman, thank you. I'm a little disappointed in your testimony because you've always indicated to me that you were perfect.
Don't tell my wife.
All right. Seriously, you have to use the information you have, and you're not going to discard any of it because you need it. You need to know what the facts are, and you'll run down every fact if I know you very well. I guess I can just cut mine short by saying when there's no degree of authenticity and no completely confirmed testimony, coupled with a cry or a whimper of anonymity that they don't want to know who they are, they're afraid they'll lose their job. When you got that type witness, compared with the witness such as yourself and this panel of every one of these people that are testifying, and you could testify under oath because we could require that and you'd be willing to. And the testimony is going to be read by the 435 members of the United States House of Representatives, and 100 are their staffs over there, and by millions of people that listen to you. Call them forth to come forth and give me that information. Not much else you can do, is there?
If there is, I really wish someone would suggest it to me because I would try it.
But you can sure remember that there's a difference in the authenticity of a guy who says, "Now I'm going to tell you this, but you can't tell anybody who tell it, and be sure and don't tell them I work for them." And a guy that steps up there and toes the line and tells you what the facts are and leaves you to make that decision. You're not so unfair that you'd fire a guy that gave you news that you didn't like or shoot the messenger, are you?
No, I truly, I would like to assert, and it's an assertion, but I believe it can be backed up, that I believe that I am, and that the management team I have hired consists of people who can hear bad news, act on it, and deal with the truth and not punish the messenger. I believe that's what we have in place at NASA. If someone else believes to the contrary, then again, I would like to hear about that, because I will fix it.
You're in the same situation of Mr. O'Connor when he said, "I cannot say conclusively that none of the incidents reported to the committee ever happened. However, I was unable to verify that they did." And you have to have verification, don't you?
That is correct, sir.
And you have a chairman here, Mr. Gordon. You had chairman of the subcommittee that have expressed their belief in you and belief in the system and belief in the men and women that go at great peril into a fragile mission that's still fragile. I don't care what anybody says, and carry it out for us. Those are the people you want to believe and that you have to take testimony from, that you can rely on. I yield back my time.
Thank you, Mr. Hall, and Mr. Griffin, or Dr. Griffin. I thank you and all of our witnesses for your time today. I apologize for the musical chairs. We've had different meetings going on. Let me just quickly conclude. Once again, complimenting you and congratulating you on a successful Endeavor mission. I think it once again proves that when things work out, you're brilliant. Let me just quickly quote some conclusions from the earlier report. Many of the cultural and structural issues identified in this report as pragmatic have existed for many years, and some have existed since the earliest days of the astronaut program. The current medical and operational leadership at NASA inherited most of the cultural and structural issues identified in this report. These issues are also ingrained and long-standing, and that it will take senior leadership action to remedy them. To some extent, it puts you in the position of having to push the noodle from behind. I know that's difficult. You've said all the right words today, and you meant it, and you're sincere about your openness. You do have to keep in mind, though, a lot of folks don't report directly to you. And so you know all of this. We don't have to go through that. So let me just once again say that I was pleased with Dr. Williams' testimony, and I'm sure he's going to get back to us on those, what will be done and what won't be done. That will be very helpful. I guess I will have to say, why did you so narrowly define Mr. O'Connor's mission as to only inquire about alcohol abuse on the day of the mission, rather than what I think are the more, and I think everybody here, that stated, the larger issue of an openness and a feeling of comfort with the folks involved being able to come forward?
Well, there's a bit of a misperception there. Bryan did, as part of his charter, ask also of each and every flight surgeon, have you felt uncomfortable coming forward? Do you feel comfortable coming forward? So that was part of it. Now, the restriction to dealing with alcohol abuse in the immediate surroundings of a flight, distinguishing between urgent and important, was the most urgent aspect of all of this, because that is an actual flight safety issue. Colonel Bachmann pointed out the sad truth that we are all flawed human beings and that many very highly accomplished people do have problems with relationships or problems with alcohol. But if there were to be, and I'm not saying that there is because I've not seen it, but if there were to be an astronaut who had a problem with alcohol but managed to suppress that problem in the immediate flight environment, we would not have a safety of flight issue. Whereas if somehow someone managed to show up impaired for a flight, that would be a safety problem. So with a limited amount of time to get on top of the more urgent issues, we asked Bryan to focus on dealing with those things which had been specifically raised in the report that I felt as administrator absolutely required an early investigation. Now we have other things going on. We're not ignoring the other aspects. You heard Ellen Ochoa talk about the survey. We absolutely accepted that recommendation. As I said, I can't wait for the results of that survey. I want to know. We have re-emphasized NISRIS. I have made personal and public appeals for any concerns to be expressed with promises of protection for those expressing the concerns. So we're not ignoring the other aspects. But the most urgent thing was to deal with immediate safety of flight issues that potentially had been raised by that report, and that's what I asked Bryan to do.
I just read it differently. I read the alcohol problems as isolated in the past, and that he said that the bigger problem was a lack of comfort by Surgeon Generals and others to be able to come, or medical surgeons to be able to come forward, whether it's a diabetes problem, you know, whether it is a migraine headache that day, whether, you know, again, you know, we saw the accident two different ways. I thought he raised other issues that were more important. But I think that through this anonymous, and Dr. Oaks, I congratulate you on moving forward with that. And Dr. Williams, again, I think you have a good plan. And I think simply by raising this issue in an uncomfortable way for you, unfortunately, that it will probably do more good than anything you can do to put people on notice that these problems that you inherited need to be, or potential problems that you inherited need to be changed. And again, thank you for your candor, for your service to the country, and for another successful flight. And this meeting is adjourned.
Thank you, sir.